No, ARMD is not preventable, but if we detect it early and we start the treatment early, then we can minimize the damage to the retina and also we can stabilize the vision. The other thing is, if the patient has a family history of AMD or any of the risk factors which are present, then smoking should be avoided at all the costs because it increases the risk of AMD. Also, multicentric trials have shown that multivitamins play a major role in retarding the progression of dry AMD. Age is the greatest risk factor. ARMD is commonly seen in patients over 60 years of age. Although middle-aged population can also be affected, but the risk of AMD increases with increasing age. Family history is another risk factor for ARMD. So if family history of AMD is present, that it increases the risk of AMD. Smoking also has a correlation with ARMD, and white population are more predisposed for ARMD. And if there are presence of comorbid conditions, जैसे hypertension or cardiovascular disease or any other lung infection, then it also increases the risk of AMD. All patients over the age of 50 years, if there is any family history of AMD, or if there is presence of cardiovascular diseases or any of the risk factors which are present, then they should see the retina specialist once in a year. All the other, if you see any symptom of AMD, which is like sudden onset blurring, sudden onset distortion or sudden decrease of reading vision, then also you should report to a retina specialist. You can detect the changes of AMD very early if you use something called an Amsler Chart. So this is the Amsler Chart. You have to see it at home for detecting any symptoms of AMD. So how to use this chart at home? You have to keep it at a reading distance, you have to wear your reading glasses, and you have to close one eye, and you have to see at the center of the chart. You have to see if there is any black spot in the center, any missing letters, any distortion which you see on the chart, or there are any waviness of the lines present, or the corners are bent or wavy. If you see any discrepancy in this Amsler's chart, you should report to a retina specialist immediately. So I would like to say that AMD is treatable if we detect it earlier and we start the treatment early. So a retina specialist should not miss the diagnosis of ARMD.